Hi, my name is Taylor. I'm one of your medical assistants here at RBI. Today I'm going to be going over some information for injections. So today I have the testosterone vial here. It's brand new, so we're going to pop open that top cap. And then I'm going to take an alcohol pad and cleanse the vial. And then when you get your testosterone, you're going to receive two different size needles. So you have an 18 gauge to draw up the medication, and you have a 23 gauge, usually, to give yourself the injection. So first we're going to screw on the 18 gauge needle. So these are Lorlock, these screw on. And then you're going to remove the cap to the 18 gauge needle. You're going to inject that into the center of the testosterone vial. You're going to pull back to whichever dose was ordered for you. This patient in particular is on 0.5 mLs. So you're going to pull that back to that 0.5 ml mark. Remove the syringe from the vial. And I'm going to place the cap back on the needle. And then I'm going to screw off that 18 gauge needle and put the 23 gauge needle on. And then just to get rid of the air bubbles, you're gonna push up until there are no air bubbles left. So to give these injections, you are either going to inject in the ventrogluteal, which is your hip muscle, or the vastus lateralis, which is upper thigh, or you could do the deltoid. So I will show you where to inject in those areas. How to inject testosterone in the ventrogluteal muscle. Have someone place their hand in this area, and you want to go right in the corner of your thumb and your index finger. So then we're gonna cleanse this area here. I'm going to grab the syringe, and you're gonna go in at a 90-degree angle. So 1, 2, poke. And then you're gonna draw back slightly and make sure there's no blood, and then slowly inject the medication. Then remove the syringe, apply pressure, make sure there's no blood. If you want to inject in the vastus lateralis, which is your upper thigh muscle, this is something you can do to yourself. So generally I like to have patients sit down. And then when you are looking down at your thigh, you want to basically split your thigh down the middle. You're going to go about 1 inch from the middle of your thigh, and then I'd say about 1 hand length from your hip. So that would be about this area here. And then remove the cap from the syringe. You're going to go in at a 90-degree angle. So you would inject, you would pull back on the syringe to make sure you have no blood, and then inject your medication slowly. After that, you would remove the syringe, apply pressure, and make sure that all bleeding has stopped. Okay, so to give you an example of how to inject in the deltoid muscle, so for this, you would go about 3 fingers down from the shoulder muscle, and then you would go at a 90-degree angle directly into that muscle, pull back slightly to make sure there's no blood, and then slowly inject the medication. Then you would remove the needle completely, apply pressure, and then make sure the bleeding has stopped.